Hey everyone, I'm Dr. Leila, and I've been working with men for more than 20 years, mostly on prostate problems. Welcome to my channel where I share what I've learned from years of working in a clinic to help men like you get their energy back. If you're a man over 60, today could be the day that changes everything for you. Think of how nice it would be to wake up every morning feeling good and not having to go to the bathroom every hour, or having to get up in the middle of the night to go to the bathroom. But let me be honest with you, you can be doing things every day that you don't even know are making your prostate bigger. This might turn what should be your golden years into a fight against pain and frustration. As a doctor who has seen many patients come through my doors, some living well into their 90s and others dying far too young, I've seen how small, easy to overlook habits can make a big difference. Today, I'm going to tell you about the 10 most prevalent ones that could be making your prostate inflate up, like a balloon ready to pop. And believe me, the first habit we'll talk about in the conclusion is it's so much a part of our daily lives that you can be doing it right now without even knowing how bad it is for you. Let me show you a picture from my personal practice. Last month, I saw a patient named Robert. He was a retired engineer in his late 60s. He came in looking defeated and told me that his social life had been smaller since he couldn't sit through a movie without leaving the room several times. Nights were worse. I would wake up 4 or 5 times, stare at the ceiling, and wonder if this was just getting old. But Robert wasn't the only one. I've seen this narrative happen hundreds of times. George, on the other hand, is 85 years old and still plays golf twice a week and sleeps like a baby. What is the secret? It's not chance or heredity. It's the choices we make every day that shape our lives. In medicine, we call prostate enlargement benign prostatic hyperplasia, BPH. It doesn't have to happen just because you get older. It usually happens because of long-term inflammation caused by things that can be controlled. If you ignore the early signs from your body, such a weak stream, dribbling, or the sense that your bladder never fully empties, it can get worse and turn into acute urine retention, a medical emergency when you can't urinate at all, which can cause severe pain and possibly hospitalization. If you've ever felt that your bladder wouldn't empty all the way, or if you've ever woken up in the middle of the night and had to strain to start a trickle, leave the word bladder in the comments below. You're not the only one. And today we're going to start changing that. Millions of men have BPH, but we can change that if we know about it. Let's go through these habits in order from 10 to 1, talking about why they are bad and how to fix them. I'll tell you tales of my patients, provide you some science-based information, and give you some advice to make this feel real and doable. The first bad habit is not drinking enough water. It doesn't make sense, does it? I encounter a lot of elderly guys in my clinic who cut back on fluids, especially in the evening, because they think it will mean fewer trips to the bathroom at night. They say, less in, less out. But that's just wrong. Our urinary system works like a well-oiled machine, but dehydration messes it up. If you don't drink enough, your pee gets very concentrated. It's like a thick, acidic sludge full of waste materials like urea and ammonia. This drink hurts the bladder's fragile lining, causing inflammation that spreads quickly to the prostate. Remember your basic anatomy. The prostate is like a donut that sits around the urethra at the base of the bladder. Concentrated urine that irritates the prostate over time doesn't stay place. It makes the prostate expand and blocks the passage of urine. In my experience, popular medications like blood pressure diuretics or allergy antihistamines make this worse because they dry you out even more. Mike, a 72-year-old truck driver, was drinking a lot of coffee but not much water. He got infections over and over again, and his prostate grew to twice its normal size. Research published in the Journal of Urology supports this assertion. Dehydration is linked to exacerbated BPH symptoms. The solution? Be friends with water. Don't drink too much at once, as this will make your bladder feel full. Instead, sip slowly throughout the day. Start your day with a glass of water to rehydrate after not eating all night, and then have another one in the middle of the morning. Look at the color of your urine. It should be light yellow, not dark amber. If it smells bad and is dark, your body is begging for aid. Carrying a water bottle around has changed the lives of sufferers like Mike. It's easy, natural, and one of the best ways to protect yourself from prostate problems. Moving on to habit number 9, the sedentary trap, which I call chair tyranny. As we get older, that nice recliner becomes a safe place to binge watch shows, go through your phone, or catch up on emails. But sitting for a long time is like slowly squeezing the life out of your pelvic area. The pressure on your perineum, the area between your scrotum and anus, squeezes blood vessels, which cuts off oxygen and nutrients to the prostate. It's like kinking a garden hose. The flow slows down, which causes tissue to become inflamed and feeble. According to a study from Harvard, men who work at a desk or have hobbies that keep them sitting down are 30% more likely to get severe BPH. It also makes the muscles in your pelvis weaker, which are the ones that hold up your bladder and prostate. If your muscles are weak, you won't be able to fully empty your bladder, which can lead to stagnant pee and bacteria growth. I remember taking care of Paul, an accountant who was 68 years old and sat for 10 hours a day. What were his symptoms? Infections and constant dribbling. We got him moving, and he said that his flow and vitality were better in a few months. Use my 32 rule to break the cycle. Stand up and move for 2 minutes every 30 minutes. Do some small leg swings, stretch, or walk to the kitchen to get some water. This goes back to habit 10. You don't need a gym. Simply keep moving to improve your circulation and maintain your muscles toned. Your prostate will be smaller and healthier, and it will reward you. Habit number 8 is drinking too much coffee. That morning coffee routine? For a lot of people, it's holy, and 1 cup is typically enough. But drinking a lot of cups of coffee, energy drinks, or black tea can make your bladder twitchy. Caffeine is a diuretic, which means it makes you pee more, and it also irritates the bladder muscle, the detrusor, which causes it to contract in an irregular way. This means that if your prostate is swollen, you may feel the need to go right away, have spasms, or even leak. It also makes the neck of the bladder tighter, which makes it harder to empty and leaves behind pee that causes inflammation. The British Journal of Urology published a study that indicated that males who drank more than 300 milligrams of caffeine a day, approximately 3 cups of coffee, had twice as many BPH symptoms. Tom, Sarah's husband, drank 4 cups of coffee a day and always complained about having to go to the bathroom. Cutting back to 1 and switching to herbal teas like chamomile, which calms the bladder, made a huge improvement. If you feel more urgent after that second cup, try decaf or peppermint tea. You may keep your traditions and protect your prostate by making small changes like this. This shows that moderation is the key to long-term comfort. Habit number 7, eating a lot of spicy and very processed foods. Life is too short to not appreciate flavor, but eating spicy chilies or junk food like chips, sausages, and microwave dinners every day, they mess with the prostate. Capsaicin and other spices cause systemic inflammation, which makes burning sensations during urination worse for people who already have sensitive prostates. Processed foods are even worse because they are full of sodium, trans fats, and other chemicals that mess with hormones. They raise levels of dihydrotestosterone, DHT, which is the hormone that makes the prostate develop, and they make you hold on to fluid, which puts strain on the urinary system. The World Health Organization says that eating a lot of processed foods can cause long-term inflammation. I had a 65-year-old chef named Javier who was addicted to spicy fast food. His PSA readings were high and his symptoms were getting worse. It became better when I started eating anti-inflammatory foods. To fight this, eat foods that are good for your prostate, such tomatoes with a lot of lycopene, salmon with a lot of omega-3s, and pumpkin seeds with a lot of zinc. Think of platters with lots of colors, including berries, greens, and avocados. One story. A group of my patients took part in a prostate plate challenge, which involved switching from processed foods to whole foods. They said their symptoms got better by 40% in a few weeks. It's not about doing without, it's about nourishing your body smartly for a full life. Holding in urine is the 6th habit. We've all done it. Been delayed in traffic or a meeting and ignored the urge. But if you do it too often, your bladder will stretch too much like a balloon that has been used too much, which will weaken its muscles and make it hard to empty completely. That pressure pushes on the prostate, making it swell, and residual pee makes infections possible that can lead to prostatitis, a painful inflammation that needs antibiotics. Elderly men are more at risk because they lose control of their muscles. The New England Journal of Medicine says that holding on for a long time doubles the chance of infection. Frank, Linda's dad, 74, held it while driving for a long time, and he got acute prostatitis. Now he makes sure to take restroom breaks on time. What is the cure? Listen to what your body is telling you right away. If you have nocturia, nighttime urination, empty your bladder before bed. It's really a matter of respect for how well your body works together. Your bladder and prostate perform better when they're not stressed. We're halfway through. If this is making sense to you, please subscribe to my channel and hit the bell symbol. Every video is a step toward becoming stronger. Let's keep going. Habit number 5, smoking or being around people who smoke. Cigarettes are bad for your lungs and heart, but they are also bad for your prostate since they contain over 7,000 chemicals and 70 cancer-causing substances. There, cadmium builds up and nicotine narrows blood vessels, cutting off oxygen to tissues and causing oxidative stress, which is like rusting your cells from the inside out. Smoking makes inflammation worse, which makes it harder for the body to heal. Studies in The Lancet reveal that smokers are 50% more likely to get BPH and cancer. Even smoke that isn't active matters. My patient Alex, who doesn't smoke but was exposed to smoke at work, started to show symptoms that were similar to those of a smoker. Are you going to quit? Benefits start right away. Better blood flow in just a few weeks. Talk to your doctor about patches or support groups if you smoke. If you don't smoke, stay away from places that smell like smoke. It changes the game for how long the prostate lasts. Habit number 4, not going to checkups. It's bad for your prostate health to have a tough guy attitude and only see a doctor when you're in pain. BPH doesn't show up until it's too late, but PSA tests or digital rectal exams can find it early. Think about Carlos, who is 70 years old and overlooked faint streams until he had to go to the hospital for an emergency catheterization. A regular checkup years ago could have stopped it by making certain changes to your lifestyle. After age 60, urology guidelines say you should get screened every year. Don't let fear hold you back. See it as a source of strength. Early intervention keeps quality of life and opens up natural possibilities. Habit 3, eating too much red meat. Grilled steaks are appealing, but eating red or processed meats, like bacon or deli meats, every day fills your body with saturated fats and cooking chemicals like HCAs that cause inflammation and mess with hormones. Arachidonic acid makes prostaglandins stronger, which makes swelling worse. High heat makes cancer-causing chemicals. Studies of the gut suggest that it slows down digestion and puts strain on the pelvis. The American Cancer Society says that eating a lot of this can cause problems with the prostate. Balance with moderation. Only do it twice a week. You can trade for lentils, chickpeas, or salmon. Patients who eat a lot of fish see their inflammation go down and their vitality go up. It protects with flavor. Habit number 2, not paying attention to belly fat. That spare tire around your middle isn't harmless. Visceral fat releases inflammatory cytokines, TNF-alpha, IL-6, and turns testosterone into estrogen, which makes things grow. It squeezes organs together, making the need to go worse. Is your waist more than 40 inches? According to NIH studies, the risk goes up 3 times. Changes in hormones might sometimes cause problems with erections. Make long-lasting improvements like eating whole grains, cutting back on sweets, and taking walks every day. As my clinic groups have shown, losing 5 to 10% of your body weight makes symptoms much better. Finally, habit number 1 is persistent stress that isn't addressed. This silent killer floods your body with cortisol, which makes everything inflamed, tightens your pelvic muscles, and makes you feel like you have BPH discomfort. It makes illnesses worse by lowering immunity. Older males keep their problems, money, family, quiet. But deep breathing, walks in nature, or laughing can lower cortisol levels. David, a patient who was stressed out about retirement, noticed his symptoms go away after meditating for 10 minutes every day. It's mending from the inside out. With this information, what's the first thing you do? Choose one habit. Drink more water or move around more, and stick to it. Being consistent makes you stronger. If this helped, please subscribe, share, and let me know how things are going. You can change the tale of your prostate for the better. See you soon.